I'm a junior doctor as part of the South Thames London Foundation School. I'm currently working on a gastroenterology ward, but I was part of the coronavirus, so COVID-19 rota, the emergency rota that was put together, whereby all doctors are working to support coronavirus patients during these difficult times. Obviously the mixed messages about protective equipment at the front line from the beginning. So I think we struggled, the juniors, but also the rest of the workforce struggled to understand how the PPE will be provided in hospitals, and there were mixed messages provided. I think the kind of like the blind leading the blind, not knowing what will happen, and there were times when the guidelines would change so quickly that we were being sent mixed messages. So yeah. I looked after coronavirus patients with gloves and apron and a surgical mask that you would wear. I would quote my mother because I sent her a selfie from work, and my mom looked at me and she said, she laughed and she said, I use that mask when I go shopping. So in a way, it's
scary,
not
isn't it?
the PPE that you would think you'd get, but because of the mixed messages that were the guidelines at the time, even if a patient was positive, you would just simply wear a surgical mask, gloves, and a see-through apron, and you would go and do your bloods, you would go and do your ABGs, your cannulas on these patients, but that would be putting you at risk. And no wonder 4 weeks in, I was down with coronavirus. I had muscle aches and pains, nose, smell, and taste, and I had to take time off. I've been at home for 10 days until I got over the virus. I didn't have as bad as other people. I was very fortunate, but it was a dreadful experience. I think the most difficult aspect would be the fact that we would be looking after patients who have nowhere, so who have no one to be there for them during these difficult periods. We would be the only ones looking after them from a medical perspective, but now we would have to fill in the gap that's been made for family members who are not able to visit them during these difficult times. I think one difficult aspect was also the fact that we know that some people may not be healthy enough to survive. So in spite of everything that we did, we knew that by the end of it, there will be people who will unfortunately pass away. And I think the most difficult time would be delivering the bad news through an artificial way, through a phone conversation, and then the family not being able to see their relatives and be there to hold their hand during these difficult times. But contrary, we would be there, and we would do our best to support relatives during these difficult periods, and we would be there to hold their hands and to assist them at the most difficult time period of their life. Is for us, the junior doctors at the front line. Yes, it was a very scary experience, but similarly, I think it was something that required a lot of courage from a lot of people. And yes, it was a bit stressful for us to be put through to this process, but I think there's a true sense of camaraderie at the front line. You are still there with your colleagues. We're all in the same boat, and we're doing our best to protect our NHS, but we also have to look after our own mental well-being and physical well-being as well. So for example, I would have days when my hands would be sore from hand washing and red with crackles and in the skin. So I would have to remember to apply cream at the end of the day, and I would have to have my moments of silence and meditation at the end of the day, just to make sure I recharge my batteries for the day to come. You are unwell, if you think you've got some chest pain, or if you're feeling unwell, do see your doctors, do see your GP. They are still open and they are still there for you, and they will do their best, and they will see you using an aseptic technique so that you do not contract the virus from them. And in fact, the hospitals have applied a policy where they separate the hospital into clean and dirty areas, so that you can see a clean doctor who's not been exposed to coronavirus, and they could take care of your heart problems, and they could take care of your sepsis and so on. But do not delay going into hospital is my main message. So the whole Pre Medicus campaign is a lockdown campaign that aims to widen access to medical school on a global scale. And with the Corona crisis, a bunch of enthusiastic medical students in our team have come up with the idea to set up weekly webinars whereby we could get inspiring doctors from the front line and medical students to share their stories of dealing with the disease, but also to share tips on how to apply to medical school. We know there are some facts out there which say that almost 60% of the applicants applying to medical school are coming from privileged schools and private schools. So we want to end that, and we want to give all people a fair chance at applying. And we could do that through free Zoom webinars, which the College of Medicine has supported us in delivering so far. And we've had a great success so far with over 18 countries involved across the globe, and with over 400 participants per webinar. And we're doing our best to keep the momentum going and to get as many participants and to share the best tips that we have to get into medical school. So Pre Medicus campaign can be found on Instagram. So if you follow Pre Medicus, so like the Greek name for physician, medicus. So Pre Medicus is where you find us on Instagram, on Facebook, also on Twitter, but also on the College of Medicine website, where there will be a link to it as well. If anyone's keen to deliver presentations for the future generation, be it doctors, healthcare professionals, nurses, OTs, PTs, pharmacists, if you'd like to get involved to stimulate the future generation and to engage them into the conversation and to inspire them to pursue a career in healthcare, please get in touch and join our weekly Zoom webinars, and we hope to see you there.